sure what how updated you are. I'm trying to move my cup so I can access my water better. One of the cups is empty. Let me just get my full
Yeah.
cup over here to the corner so I can.
I'm gonna start the recording, okay?
Okay.
Recording in progress.
Forgive the weed weed eater outside.
I can't hear anything.
Oh, okay. I think he's done anyway. Okay.
Yeah, the last time I saw you was the 26th of November, so 2 weeks ago.
2 weeks. Okay.
Yeah,
I
last
think
week I
I
was
had.
sick.
I may have updated you on the fact. Did I? Did I tell you that I skipped my pills?
No.
Okay. So I have. I mean, I don't know how much I've gone into it with you about the details of the, so the pill rotation and sort of how it affected my physical and mental health. To make a long story short, I guess I'll just say it affected my mental health in that every I had to take the pills every 6 hours, and every 6 hours my body would go through like an incredible amount of pain before and after. It was almost like it would be a huge amount. The cycle was was getting worse and worse, and it was down to a point where it would basically. What I noticed from studying it was that it would go. Let's just say with the morning dose at 6 a.m. because that's what happened. 6 a.m. I was noticing that it would get really bad, like the pain in the morning, and then I would think, oh, that's because I need more medication. The pain is just too much. I can't bear it. So I would take the gabapentin, my normal dose, and then I would hurt even worse. And I would think, okay, so that means I'm not taking enough, and that's usually what the doctor interpreted. So I've been going for years thinking that these pills just weren't cutting it. And
Wow.
not only were they not cutting it, it was just the pain was getting more and more unbearable. Uh, um, because it's not pain like, it's not what you imagine from a cut. Pain from a let's say a knife, right?
Yeah, I can't, I am not capable. I have no idea what kind of pain you're talking about
Okay, so
here.
it's getting to be more common now, where it's called neuropathy. So
Yeah,
it's
I've
not
heard of
that
it.
hard to find information about it these days because a lot of people as they age are finding themselves for one reason or another dealing with it, whether it's mental issues or dietary issues, whatever it might be. It is a factor of modern life, and I I could get into all the details of why I think it happened to me because I didn't really suffer with it up until about 4 years ago. Okay, everybody
Yeah.
in a wheelchair with my condition has some amount of pain, but there's something called autonomic dysreflexia, which I've talked to you about, right?
Yeah.
So I have an intimate uh, study, I guess you could say, of that condition and of how it operates within the mind and the body, the
Okay.
brain and the body. Because I've suffered with it. I've been to the hospital, I can't count how many times with it. And I received no definitive information from the doctor other than symptoms. They were not able to really tell me the cause.
Yeah.
Okay, so that had to be left up to me. Now, doing that meant researching, sources, I guess. But there's no, I just told you, nobody knows anything, and nobody's really researching it. They're researching how to address it, deal with it when it happens, but not really what's causing it. And so I did a little research. There was some information about it, and I think I might have mentioned it to you, that the AD is caused by, it's originally like a fear response. It's not completely understood, but it's in the part of the brain, I can't remember, lobotomum, something like that. It's in the rear of the brain, eh? And
Yeah.
it has to do with a fight or flight response to reactions. It's a very primitive part of the brain.
Amygdala you're talking about?
Amygdala, that's it.
That's what you and I talked about.
Yes. So I have talked about that with you. So that's good. So I just followed that train of thought and started to realize that a lot of my issues with AD came about, well, for two reasons. One reason was that I forgive me the pain. It's not really intense in my leg. Let me just check everything. The bag might be getting full. No, it's okay. Let me get a drink. I think I need a drink.
Is it because you're talking about it, which is something you told me
Yeah,
regular?
it is because I'm talking about it. But yeah, maybe I'll just get straight to the point because you already know a lot about that. Straight to the point. So I've been listening to these two, I don't want to say sermons, but teaching or dialogue about healing, specifically how it's referred to in the Bible and how it's been enacted, and I did speak with you on that, so a little bit. So I couldn't sleep several nights in a row, was up all night in pain and just.
Okay, that's since we spoke. Since we spoke last. I'm thinking.
Yes. So I was in pain a lot, and just trying to spend the time doing something that's going to benefit me and improve my health as opposed to decrease it or diminish it. Yeah. So I'm listening to these prayers or these discussions about healing, and what I'm hearing is it's not accepted in modern science. So I'm not going to get into all the details about it, but suffice it to say that it takes faith is the primary ingredient.
Yep.
Faith.
And we talked about this last time you were sharing
Yes.
with me.
So I built up. So one of these mornings I told you what started to happen was toward pill time, 6 a.m. I would start to feel better every day. Like an hour and a half before pill time, I'd start to feel better. And as the pill time approached, I'd feel more and more normal. And then just as a matter of habit, I would take the pills because it was being told by everyone, my caregivers, doctors, that you can't cut them down. And I had tried cutting down a little bit, but found it was not really making any difference. And I was still having the same issue. So after watching these videos all night and building up my faith to the point where, yes, I'm convinced this is true. This is not, faith is true. This is not a joke. This is not like, science versus. No, this is science. Okay? And so with that in mind and feeling great, I told my caregiver I refused the pills. I refused the gabapentin. Then that was 6 a.m. The other caregiver came at 8 a.m. She happens to be a nurse, and I told her what had happened. She was kind of quiet. They already know how much pain I go in, all my caregivers, so they don't really fault me for any decision that I make. and they know
Okay,
that
wonderful,
they
wonderful.
know that I'm really, I do my best to stay on top of everything, that.
Yeah, yeah, yeah.
And
They have a lot of faith in you.
yeah, and yeah,
Sorry,
yeah,
off
they
track.
do. And I she didn't she they're both nurses in the Philippines. One has actually gotten her license here in Canada. She's just waiting for some paperwork to start to like leave this type of job and go to work at the hospital. And the other one is also a nurse from the Philippines who doesn't have her credentials figured out yet. But so they both the second one is very knowledgeable, and so I asked her later. I told her what my train of thought was. They hear me praying all the time and listening to prayers and discussions, so they know where my head is at with all that. So then
Mhm.
she got me. I said, "Well, what my plan is, I still feel good. It's 2 hours later. I haven't had any issues, no blood
Oh
pressure
wow,
issues, no reactions." I
wow.
said, I'm going to have you do everything. I'm going to have you change the catheter. Go ahead, put the catheter in, no reactions. That's usually AD and pain. And then I had her get me in the chair. Was like comfortable, no reactions. I got in the chair. I went all the way till noon, which was my noon dose. I did all the morning routine. Um, and I was still feeling pretty good. I was starting to have some blood pressure issues, and I didn't want to push it. And I knew if I skipped noon, then I would really be, under the gun. And I was so proud of myself, and believed and had faith and thanking God that I had made it that far. And it just boosted my confidence and my faith a lot. So
Yeah.
then what I did that evening, I'd been trying to reduce the evening dose by little, right? And the morning dose to 6 a.m. and 6 p.m. So I had reduced that used to be 100. I was whittling down 10 milligrams at a time over like a 1 or 2 week period at a time. On
When did you start? Because I didn't know you were doing that.
I started many even months ago, and I had
Okay.
barely made any headway.
Okay.
I was at 80 milligrams in the morning, and of the amount, the 100 I was trying to cut, and I was at 70 milligrams in the evening of that, and I had just tried to cut it to 70. And so what I did after I realized that I had cut the whole 900 in the morning, I said, well, my body can do it. Why don't I just cut the whole extra 70 in the evening? So I did, and I was fine. And then the next morning, I said, I don't want to take this extra 80. I'm tired of measuring it and all this stuff. So I just cut it out, and I was okay. Then I started having some pain and symptomatic issues, but I just praise the Lord and put the most difficult part is the mental part of it. The physical part, I've pain is one thing. The mental part of it is where you start to question things and your own ability to handle it and your own ability to manage things, withstanding the pain and those kind of things. So that's where you have to have faith if you want to do something that's beyond capability. You either succumb to the circumstances or you do it. And I yeah. So then I went back to my normal dose, just removing the extra in the morning and the evening, and I've been doing that. I did that for about 10 days. And the next day that I did that big drop, oh my goodness, I had an appointment to go in for Botox procedure to my bladder, no less.
Okay.
So I actually got in a car and a taxi and went to the hospital and got on this the bed, the stirrups, you know, and they, not stirrups, but that kind of a bed. And they had to stick a needle in my bladder. It was really painful, but I made it. So that, all of that together just gave me pure confidence that, my body, the fear related to my circumstances in life had diminished a lot because of, having faith and just going like that. And so the AD, I noticed that I was able to keep my blood pressure quite steady no matter how much pain I was in, right? And then I thought, well, if I take the pills away, if I can withstand the pain and not deal with the fear, then I'll prevent the AD, and that's kind of what's been happening. But, like I said, the emotion, talking about this is making it quite pronounced, but at the same time, reducing the pills, the most dramatic effect that I've experienced is my brain. It's like injecting some kind of intellect into my brain. So it's really bringing my thoughts back and my ability to articulate and things.
Fantastic. I'm so excited to hear that, Nirmal. Sounds like real progress.
Yeah, I'm still day by day praying, going. So I did cut more. I cut another 100 in the morning. So that's.
So you did all those cuts, but then, so just because I just slightly missed that point that you said for 10 days you went back on a certain amount, is that?
No, 10 days, yeah, I went back to my 800 in the morning and the evening. I was taking 900
Yeah.
in the morning.
And so can you just explain to me, because maybe I missed that, what led you, given you had felt so much better and you were able to go to this appointment, et cetera, why is it that you went back on 800 in the morning and
That's a good question. Because it's just not advisable to drop by that amount. I was concerned about the AD, and so I dropped another 100 in the morning now, and I've been doing that for 3 days. I'm still gonna steadily drop down. Someone else asked me that same question, and I might try that, but I can see that the amount that I'm cutting now is quite tough on my body. So it's probably at the extreme of what I can handle long term, and I'm very proud. I'm very, I praise the Lord for the fact that I have reduced already by, almost 100 plus 200, 300 milligrams a day in like less than 3 weeks, and I was going at like millimeters before. So now I'm, in comparison, it's.
Yeah. So you have the confidence now to be able to reduce the.
Yeah.
It's not just gabapentin you're talking about. I hear you mention your pills, so it's other things you're taking as well.
Well,
right?
yeah, I have a few pills. There's 3 different pills that I take, and I'd like to. I don't want to try them all at the same time because then you get mixed one with the other. But I'm gonna keep
so
going.
The gabapentin you're focused on is what you're talking
about.
Yeah.
Yeah, and the reason being is because I've read up on gabapentin. If you want to, specifically, I was in when I first started experiencing weird sensations from it, I joined a Facebook group called Gabapentin Withdrawal Support, something to that effect. And it was many people, thousands of people all over the United States and Canada, and the stories about this, what they went through, was just incredible. And I was like, oh, there you go. That's exactly what I'm feeling. That's exactly what I'm going through. And they're giving it to me over and over again, and I'm getting more of it. So obviously I got to go down. And then the fear would hit me so hard of, oh my gosh, there's no way I can go down because I sit in a wheelchair all the time. And you know, these people, it makes you have restless leg syndrome. So you want to run, you want to walk, you want to work it all out. So I can't do any of that. So how am I possibly it's going to be too incredible. And so that fear would overtake me,
Right.
and then that would cause the AD, you know,
Right.
and so I still don't have the answers. I'm theorizing all these things
Yeah.
because I do want to have uh, sort of hindsight when I'm through with this process,
Yeah.
in order to specifically maybe help some other people or even help doctors with a succinct theory of how these drugs operate in the mind. I mean, in the brain. I actually have a doctor working for me. He's a Russian doctor. He was a surgeon in
Yeah, you
Moscow.
mentioned him.
Yeah, yeah. So he was just here today, and I can always pick his brain and talk to him. So it's like having a doctor come to my apartment twice a week, you know, and like, you know, he supports me in what I'm doing, and like he understands what I'm going through. He's read about a lot of the information that I have about the medications comes from his, you know, his doing his research on the phone, like because
Mhm.
he can still access all the physician databases that he could before, you know,
Okay. Yeah.
and he's familiar with all the language and things.
Mhm. Mhm.
So yeah, it's quite valuable to have.
Yeah. So right now you're in the process of more aggressively reducing the gabapentin, sort
Correct.
of every 3 days or so.
No, what I'm
And
doing is, yeah, I'm going to reduce. What he recommends is to reduce by a quantity, like 100, let's say, in the morning, and then reduce, you know, by 100 at another dose. But do it for like he says 7 to 10 days at a
okay.
time. It takes that long for the reduction to for your body to accept the reduction.
Okay. Okay. Okay, so here you are today. Your energy is way up from many of the other sessions we've had together. Your voice is clear. Um, and so you're just thinking a lot, though, about it, which is affecting things, perhaps. But
Yeah,
can you
yeah, it
step
is.
into, how quickly can you step into change state as a result of faith?
And very quickly because I immerse myself, and the Bible calls it the Holy Spirit. So basically, yeah, it's just the presence. It's like the sort of enveloping presence of God that you know you can use in your life, and I do it also by I have like uh, quotes from the Bible that I printed and put on my wall. So I basically surround my atmosphere with an atmosphere of like grace and an atmosphere of like good thoughts, you know, like I don't and try not to watch. I found that I had gotten too delved into politics, which you know, how could you not? The world's like a tinderbox right now, and so
Mm-hmm.
so I was that wasn't very good for my pain level sometimes, you know, because I have dual citizenship in the U.S. and I lived there most of my life, so I I I have a lot of connections with the U.S. and so you know
Right.
I'm able to follow their election. I know their political process, and so yeah, I was following that, and I was following the events in Israel, the political events, and then Canadian political events. So yeah, it can be a bit much. You know, it's not the most healthy thing to
Mm-hmm.
stay focused on. So
Mm-hmm.
then I between that and the Bible and just discussions about not just the Bible but about thoughtful like molecular biology. I don't know, you name it, whatever. Yeah, physics stuff that
It speaks to what you're experiencing from a
yeah
faith perspective.
yeah yeah
Mm-hmm.
yeah. Like I certainly don't. I certainly want to under. it may not be possible to understand the physics of it, because when God operates, he doesn't operate within the realm of the physics, even though he created those rules, those laws that exist. So, they can take on another form when, if he wants, just like, it happens in our daily life. We may not be aware of it all the time, but yeah.
Mm-hmm.
So, uh, but there's a lot that can be deemed from observing the phenomenon a lot. So, I'm trying to observe myself. I'm taking, the caregivers chart down my blood pressure. I take it regularly. I'll get a oxygen whatever you call it, oximeter, and I just um, yeah wanna, and the doctor wants me to. So yeah, Dr. Krashikov, the neurologist that
Mm-hmm.
runs the Bluesen, he's been closely in contact with me, and
Oh,
yeah.
so that's a change, right?
Yeah, well, he has been. It's like once a month, let's say, which is a
Okay.
lot for him because he's a very busy man. So he's giving me a lot of his time, right? And
Okay.
and he will talk to me for an hour. He travels all over the world and does speeches and things. So, but he's on board. He said he's on board with me reducing, because he's seen me up, and he's seen my theories, and he's out of theories, basically. But
Yeah.
I happen to think that he knows more than he's willing to let on to me. But he's also at flabbergasted. He's a not flabber. He's what's the word, when you're out of options. You're like, you don't know
Well, the
what.
medical system does not provide him with the options that he might otherwise understand might be helpful in your case. Like he's bound by the medical codes of or medical ways of he has to practice.
Yeah, and he's used to medicine. And he maybe, like, what I meant by that was that the gabapentin, maybe he even, either that, or it's I'm because here's the question I asked him the last time I spoke with him, which wasn't that long ago, maybe 2 weeks ago, um, just before I did that cut thing. Uh, I asked him if my train of thought took too long to. I'll remember it. Yeah, I asked him the if he had encountered anyone else that described their symptoms the same way that I had, and he said no. At first, I had sort of asked him that in a roundabout way before a number of times, and he said no, and I thought he was being disingenuous, and I thought, you know, maybe he's has to protect his career or something, because I'm thinking, man, other people must be going through this. These drug companies have to be made aware that this is crap. This is a deadly, this is a deadly pill if you don't if it doesn't associate with your body or your nervous system, like, say, or when my instances, you start getting feeling back in your legs, some sensation, then it just starts confusing the crap out of it, and they over prescribe it because they're dealing it's being prescribed for pain, or for anxiety, when so the doctor may be aware of all of these kind of factors, but doesn't really know how to articulate it. So that's what I was thinking. He was just saying, no, haven't seen anybody else. But then he said it again, so maybe he was being honest. And if that's the case, that still doesn't seem like it's true. I can't think that I'm the only case of this happening. So I don't know.
How important is it to you to have his validation of your experience?
Not really. I want his help more than his validation. His
Okay.
brain, yeah, I want his assistance. And
Mhm.
I know of I have other friends uh, in my condition, not as long in a wheelchair, uh, that take gabapentin and other drugs, even more strong than gabapentin, uh,
Mhm.
that take them regularly, and they want to. Here's the thing: I don't think that either they may have said it to me and I just didn't take it seriously at the time. I don't know, but I don't think I was told that long term I was going to have some possible detrimental effects, side effects from the drug. I don't remember being told that, so my fellow peers that are taking high doses of this for length of time less than mine, I don't know if eventually but he says that people have been taking it for, when I asked him many times, people have been taking this for many years and they don't have an issue. But then when I'm looking at the Facebook group and they're telling me all this stuff like get off of this stuff, don't stay on it, it's terrible, cut it, I cut it, giving all kinds of recommendations on how they cut it, and then I'm thinking, oh, then I stopped like a year ago or more. I wasn't even looking at that group because it was too scary for me, right? And but back to the doctor, I and my other friends, I don't know. They didn't seem to have. I didn't hear from my friend, for instance, that takes a high dose, almost as high as the dose that I take, and he's been taking it for quite a few years. He's a little younger than me, but not much, and he has he seems pretty stable. I don't think intellectually it helps him. Um,
Mhm.
Probably makes him more sleepy and just less capable of multitasking or multi-thinking. But
Mhm. I'm also wondering if it doesn't also relate to patients' ability to be able to identify how fear and it actually plays
absolutely,
into the whole situation. They may just assume it's just like this is what my doctor says. This is what I believe. This is just pain, and it's associated with my condition for some reason or other, whether it's called neuropathy or whatever else.
absolutely, it's a huge part of it. It's a it's a huge part of it. It cannot be understated. How and that's what I want to get to is how fear and doubt and other feelings that the Bible gets into, like lust, anger, re, sort of retribution, these kinds of things, how they affect your nervous system and thereby affect your fear and directly. So the more you get all those things under control, the less fear you have. So that's what righteous means. That's what righteousness it means. It means getting rid of all the, like looking at a neighbor's wife with lust,
Getting rid of or letting go of
letting go of, yeah,
or turning
processing,
away from.
turning away from, exactly. Uh,
Okay.
like, yeah, those thoughts will mess up your ability to have faith. They'll mess up your ability to feel good about your decisions and where you're going, and also to have clarity and ultimately to hear God's voice in your head. And that's something that I didn't even know. I still don't know is but now it's happening to me more. But that's what the Bible speaks of, and I was like, what? What are you talking about? You know, when it came to that, hearing God's voice, and you see that in the Bible, the Old Testament, a lot of people will just prophets and things start speaking like God's voice.
Well,
No,
I would is okay. So just about just like in terms of psychology, there's a huge amount of science that is going into scientific understanding of psychology and also sensory perception and experience. So there's a great deal in that field that associates pain with psychological distress
okay,
and so mental health. So there's it's becoming very pervasive and very
yeah, yeah,
you know, commonly understood now.
It is,
Somatic
yeah.
therapy is very much related to that. So, but then I would challenge you personally, just from the point of view that, from my perspective, I have a different perspective, and that is that all of those things are true that you describe as it relates to the Bible. But I don't have to be a perfect fan of God or follower of God. I truly believe in the Bible and the advice that it gives in positive ways, and I believe everything you're saying is true. But I don't have to be praying to God, unless of course I'm in I have in different ways, but it doesn't have to have his name on the call. You know what I'm saying? Like, I don't have to be calling him directly. I'm calling somebody else, and it's giving me as good advice. So I'm
That's
just
true.
saying,
That's true. That's
I can
true.
hear the voice you're talking about. I name it in different ways.
Well, in the Bible it says many a stranger is disguised an angel. Many, an angel came disguised as a stranger. Something to that effect.
Yeah, I kind of believe all information is available all the time. We just can't. Our state doesn't allow us to necessarily always access. So the way Einstein intuited universal laws to do with nature, etc., and energy. I'm just offering you my personal perspective, not for its worth, but just simply because given that you've grown up with all the learnings that you did with the cult, and given your request that you want to be able to see yourself more with more clarity, and see what you're going through with more clarity. That was something you said at the beginning. I'm just sharing with you my own perspective.
Yeah.
Because,
no, thank you. Yeah.
Because you're very caught up in this all being as it relates to Christianity, and I'm saying, is it perfectly related to Christianity? Yes, in many ways, but also in many ways it doesn't have to be. It can be scientific.
It is scientific. I agree.
Yeah.
It is scientific. It has to be scientific, and that I understand. No, maybe not so, but that's the part that you leave to God. He can take care of that, And of course, I don't have to be. I don't have to be like everything is on God. No, because otherwise my brain would be not really necessary. What I'm saying also is just that if you're I'm in a unique situation. You just mentioned you might pray, like if your mother, God forbid, was had something like her heart valve was getting shrinking or something, and you knew that it was either surgery or you pray. You're gonna pray because you can't do anything about it, and so I'm in that similar situation, 24/7 nowadays, and so
You have a lot more experience.
yeah, God and God, again, this is I don't feel this is my opinion because I feel it's truth, but God, at those times, um, um, puts you in a position where I would have been gone long ago if it wasn't for my faith in God. I would have been gone. I would have just succumbed to one of those fear attacks, and I would have my AD would have blown up, and I would have just been everybody would have like, oh poor, yeah, he had to go. It was so painful. Yeah, it was it's understandable what happened to him. In fact, there's been many instances where that could have happened, where my BP was over 200 for a long time, and I was just, struggling and taking this pill and that pill, and then recovering for the next 2 or 3 days. That's happened, I don't know, many, many times. So I've been through, that certainly wasn't taking me to a place, you know, green pastures or anything. That was taking me to either the an old age home or the hospital or dead. That's where that was taking me. Or assisted suicide. Oh yeah, there's not much that the doctors or this society had to offer to me in my condition, you know. So that's when God steps in. If you don't want to accept it, then it's. I might have muted myself.
No.
Okay, I set a number in it. Go to sleep. Okay. Um, I don't want to hang up on you by accident. Um, so yeah, you end up.
Some people don't want to accept it, is what she said, and they may not believe, they don't consider, they don't open themselves up to
That
a different way of looking at it.
yeah, they don't open up to, first of all, the possibility, and maybe it's a brain thing, but you know, but it's also a pride thing. Um, they don't open up to the possibility that it's logical actually to assume that there is a God. Now, if you assume that logically, because like say you can't assume that there is no God, then that's one level of logic that's very basic. But then if you assume logically that there is a God, uh, based on the fact that um, you know, creation doesn't exist from nothing. Like, so you've never had, you can't, you know, break apart a machine and put it in a box and shake it up for 2,000 years, and it will turn back into the machine or even anything distinguishable. You know, so um, there is logic that points to God. Now, it's fearful to think that there's a God, because then uh, the size and you know, like I was looking at it, they just have opened up another stretch of of this satellite that's taking pictures. I can't remember the name of it. It's taking pictures of the galaxy, mapping the galaxy, and this little portion of the sky. You couldn't even see the number of there were galaxies there. There were exploding suns. There was just like just yeah. This was so yeah. It's too scary to fathom what a mind that could possibly have all of that inside of it um, would have with you. But then at the same time, in our own right, we feel like gods because we want to run things here. It's scary. Yeah, it's all scary. So you know, but it's a lot less scary if you uh, get rid of all this baggage that you have that the world puts on you. Like I didn't even get into with you all the baggage of the experiences of my childhood. Like you know, I you know, you would probably just your mind would start like racing, thinking of all the ways that this could have affected somebody in that situation, right? Just from your clinical experience or your training, like you'd be wondering, like, oh my gosh, what does a kid in that situation do? How do they respond? What do they feel? How does it affect them in the long term? You know what I mean? Like, so I've been through a lot of those type of situations, and so I don't know, you know, how many knots were tied around my heart, or how many knots were causing me to make a decision based on an incorrect assumption, based on another incorrect assumption, based on three more incorrect. You know, it's like my brain was already like, um, you know, encountering certain emotional situations. It it was at a severe handicap because it didn't know how to um,
Get around, overcome.
yeah, it was like wrapping layers of, you know, unnecessary layers of thought in front of whatever it was dealing with. So especially in when it came to relationships, a person walks in the door, you're having a relationship with them, even if it's the UPS guy. You have 2 minutes where you have to transfer the packages and you have to write down everything, right? You have to sign your name. That's a very simple, brief relationship that you have with somebody. Even to that, like, oh, you know, hi, I can't think of exactly what, but there would be like a hesitation or a concern about the name or whatever, what have you, that's just an example, but somebody that's been through things like then it affects every little, like, actually just before I started having these, I was going downtown to um, enrolled in a like a leadership training course. I cannot remember the name of it. It's well known worldwide, and you go up in a boardroom in one of the high rises downtown, and I was wearing like suits or nice dress clothes, and then I had a chair that lifted me, and I was practicing giving speeches in front of all the other people, professionals like yourself, in the room, training, doing the same course, and yeah, I was doing that, but I don't know, either my body or God, whatever, called me and said, no, you got a bunch of stuff to deal with. So then, but
Mm-hmm.
it's possible. The human brain is more than capable of coping with a lot of stuff, and people can become very powerful, like, figures, even with a huge amount of abuse and trauma. It doesn't mean that they'll be like a good leader or that they'll die well, like uh, they could die a very miserable death with
What are you trying to say though? Are you like what are you getting at in terms of your own journey, in terms of how the experiences that you've had have led you to this moment to be, in fact, what you're feeling right now is a lot of resilience in the face of very extreme adversity.
yeah, I guess that's a very good question. um, um, yeah, it's just that I was kind of driving blind or driving with, like, things waving in my windshield, and
Mm-hmm.
all kinds of that's how I was going for
Reactions. Yeah.
a long time in my life, and I talked to you about that before, just being more grounded, having a stable platform. And I know you're saying, like, the Bible doesn't have to be your only, source of that stability. And I hear you. Like, science is, you we're grounded in the real world of science and things that happen, physical phenomenon. But there's also another world of, and this world is kind of sucking into it. Like, I saw somewhere on one analysis, very good analysis by a doctor, that of the political situation in the world, and he said it's the time of the rise of the modern theocratic state, and it's true. In well, it may not be true, but at least by his analysis, in China, their communism proved to end up becoming defunct because people were they're losing their motivation, and they brought on capitalism. Not enough. Same. Now they're bringing in Confucius ideas. It's like they're bringing back the past gods, the past shrines, and then India. It's the same thing. It's the rise of the Hindustani state. The prime minister proclaims his Hinduism. He goes and he opens temples. Look what's happening with Trump in the United States. The next you'll see is Russia. They'll be doing the same thing, and it's not really because you can say it's because God is making a move or because it's more evil. It's true. All those factors are true. That there's more darkness in the world. Look what happened with these pop stars in the United States and so on. This court case that's going on. but it's also because um, people are just uh, uh, only operating within the scientific, quote unquote, logical realm is not cutting it for people's emotion. Yeah, a man can be a woman can be a man, anything is anything. Gods are gods, imagination is imagination, it could be real, we don't know. Like in India, it's like, oh, this god could be real, let's start worshiping. Ancestors, well, that could be real, it's scientific, could be scientific. And then it's pretty much anything goes, you know? It's like, so that's why, hence, these religions and thought processes evolved in society. This is my opinion. Evolved in society to bring structure, and when everybody let go of them, oh, we don't need that stuff anymore. Then structure slowly is eroding, and people are just losing their minds, left and
Mm-hmm.
right. So science doesn't have all the answers. Even if you take it like I was talking to my doctor today, the doctor friend, about Russia, and when I made that point that I just made to you about the rise of the theocratic state, he thought about what I said with regards to Russia and how communism had affected his own psyche and the psyche of other people that were there, and he said, yeah, that it had come to a point, or it did come to a point where, there really wasn't, it didn't offer much in terms of motivation. Oh, go be happy for the state. Go do your job for the state. That just doesn't cut it after a while. That's even better than saying, oh, just make yourself happy. Just go out there and do whatever you want to make yourself happy. Like,
Mm-hmm.
that just doesn't cut it. The human psyche is not satisfied with that. It needs to support other people, be supported. Anyway, the point of my whole discussion was, or my whole point was, you asked the question, was that, yeah, science is not, it's great to know it all, but it doesn't give us it doesn't underpin what is making everything move. It doesn't, it's still, the final answer is still a question. The final answer is still a question. So if you put that that's true, that science admits that the final answer is still a question, then for me to posit that that question mark is actually God is not so unscientific. It's simply stating that you don't understand what the question mark is, and I am trying to understand it in this alternate way, and I believe that your understanding of it may be lacking because you're not approaching God in the correct manner. Like, say somebody, like in the Bible, it puts God on a throne. So um, the fact is that somebody with that much authority would necessarily have to be regarded as a person with that much authority, just like so, with some awe and respect. So that's kind of hard to engender when you're looking at a question mark. So yeah, it's, that's all. Does that make sense?
That last part I didn't follow.
Well, you don't
Just
you don't get awe and wonder and worship when you think of that final answer as a question mark. You don't really have awe toward a question mark, or
I do.
oh, yeah, awe. I guess awe is, but you don't worship the question mark.
I
No.
don't. I don't feel a need to worship anything but maybe what so I guess we all have that choice, right? As humans, we make choices about what we think it matters most, what we want to worship. And I would say, so that I guess I
Well, what I meant.
um,
Sorry.
I would worship nature,
Right.
um, and the ecology of nature, and the universal laws that our environment naturally follows. And I know that we don't know everything about it, and I know that all science hasn't been discovered yet, and so I understand the question mark.
That's what I mean. You can't
Yeah.
worship. If you think of it as a question mark, you can't worship it. you don't. There's no need to worship it. There's no reason to worship it. It really has no. It has no volition of its own. It's simply
Mhm.
something that gives you life because it exists and
Mhm.
it's there. So you appreciate it, but you wouldn't worship it. Now, if you thought that somebody uh, or this question mark, for instance, that you don't know this force that's causing things to happen and maintains life as we know it and has created the atom and the we don't evolution does not explain how the atom developed. There's no explanation for that, not even close. The atom is so complicated just on that level that it takes a design engineer on such a high scope that it boggles the mind. So anyway, so that amount of respect and admiration to come to that with the question mark is not, it's a different way of approaching it. Like I don't think that yeah, anyway, I don't want to get
I
into all
think,
that, but
yeah,
that, yeah, that's
I
what.
just, I think for me, what I understand is that as a counselor is that we all have our own unique journey, and a massive part of that is finding out who we are, what matters to us, and how we want to
True.
lead our lives in optimal ways. And oftentimes those journeys all point to the same thing, which is basically what's laid out in the Bible. So that this is a great old wisdom that is very important, that ultimately does pertain to everybody, and we can define it how we want to. I mean, a lot of people who pray to God all the time don't just believe in the rules, and don't actually have faith, and don't actually think positively, and don't actually respect others, and don't actually do a lot of things. So I think it's just the inner journey
And there are a
that
lot of atheists that are very nice people, and honestly try to do good to people and things. So it's it's, yeah, it's they're on the earnest journey of life.
mhm, mhm, respect for all
Yeah,
human life, all not human life, all life. Yeah.
it's helped me w- to know that everything has a cause. Everything has there's an order to things that we
Mhm.
don't understand,
Yeah.
and if we even if we have a full understanding of science, we still there's still a lot that we don't understand, and um, there's still no matter how much we know virtually nothing compared to the amount of information there is to know. So therefore, me using that scientific logic to postulate that, I could postulate it sitting and meditating like Indians did, but the Bible tells it fine, and that was revealed through prophets and various events if you believe in them, or if you believe that they occurred, and there is evidence to uh, to support that they occurred, where God did put His direct hand and made things happen that were not possible to happen in order to facilitate His plan. And so to think that He has a plan is again putting a personality on the question mark. Okay, so yeah, that's the approach that I've taken. Let's
Mhm. Mhm.
yeah.
I'm glad you have that clarity.
Yeah,
Yeah. Yeah.
thank you.
And I'm glad that these last 2 weeks have really, like, you basically made a choice based on all your thinking, study, interaction with doctors. You tried something and you said it was beyond your capacity, and you had to have faith, and you did all that. You cultivated the faith, and you took a step that was dangerous and fearful, but despite that you believed that it would be okay, and you overcame, and this has really changed your perspective in the last couple of weeks, and I'm so happy for you. I'm really happy for you. I feel, I mean, it's not mine to feel, but I feel like that must be so, it's awesome.
Yeah, thank you. Thank you. Yeah. And the sensation, don't refer to it as, what, that word. I refer to it as a sensation. It makes it easier for me to digest. Um, the
Yeah.
sensation, as it were, is something that, if you ask me, like 6 months ago, a year ago, if I would be able to sit here talking to you and smiling, laughing, going through this, I couldn't fathom it. I would have just thought I would be a raving lunatic. So, uh, but I'm able to do it, and I'm able to put it in compartmentalize it in my brain so that I can carry on my conversation with you, and also, like you were saying before, like noticing, okay, we're talking about this and it's making it stronger, and so being being aware like that. But
Mm-hmm.
it that being able to smile and just what does it say? The Bible puts it this way: um, see something that is, even though it isn't. So, um, and
Yeah,
be
okay.
grateful for it. See it as it is. Be grateful for it is. Be grateful for it, and then make it happen. So that it's a different cycle than what the usual action is. Assess it, make an action, and then be grateful. No, it's the other way around. Assess it, make a plan, be grateful, see it happen already, and then do it. So it's a different way of the cycle. You know,
Okay.
yeah. That's what the
Okay.
Bible says anyway. That's my understanding of it. It's a
You make a good preacher.
thank you, thank you.
So okay, so we need to wrap up here, and we just need to cover a couple things before we wrap up. So, and I heard you say that this might be your last session.
Yeah, for a
Um,
while anyway. I don't know. I thought there was a limit too to the
there's
sessions.
16 and you're at 12.
Oh, okay,
Um, you can find me in the world, in the Vancouver world.
okay,
Look around, and I would be happy to continue with you at a lesser rate,
okay,
just back to the first rate you had.
okay,
But you would have to find me, and
okay,
because I want it needs to be fully your choice about whether
okay.
you want to do that,
Yeah,
and um, and then the next thing I would say is, yeah, you could have 4 more sessions through JFS. So that's always there for you. But if a certain period of time, because it depends on their wait lists of people
oh,
waiting.
I see.
So a certain point in time, if you hadn't exercised your right to have any of those sessions, then they might say, okay, that's it. We've got to move on and give new clients. So give me new clients.
I'll
Um,
probably making get a hold of you in a month or so. Let's see what happens. My
yeah,
finances are a little tight right now. That's the only thing.
yeah, I understood that, and so that's fair. And so basically, though, because you've never really emailed me since the beginning, I'm not clear about how you get in touch with me, but I also have a phone number at the bottom of my email through
Yeah.
JFS, and that you can always leave a message. So,
Okay, I'll do that.
okay. The last thing is the audio, which I'm sorry I've been so delinquent around, or the recordings. And I'll just be really honest. It's just my own, as a learning counselor, it's just my own self-consciousness and feeling a little bit
That's
shy
okay.
about
I
it.
just the transcripts might.
But I'm gonna send them to you. I'm gonna
Okay,
send. I
thank
have
you.
had it on my list for like weeks, and I noted the fact that every week I don't get down to it. It's because I'm
Okay,
avoiding it. So I will send you what I think is likely going to be the most usable copy, so that could be
Okay.
the audio. The audio might work for
Okay.
you, right?
Yes.
In terms of like the actual audio,
Yeah.
and then the transcript, like I had shared one of them with you, and it wasn't. It's really hard to.
Not the best.
Yeah,
No.
yeah.
Okay.
Thank
you.
Or videos, so it's entirely up to me, according to my supervisors.
Okay.
To get over my own worst fears.
Okay.
So, yeah.
Thank
Okay.
You. All right.
So I think that's it. I feel like this session, you tell me, but sort of sums up everything.
Yeah,
I'm on and off.
I'm good for now, and I've got to do some bodily care, and then yeah, I'll all right. Let's see. Now is the end of the beginning of December, so the holidays, the New Year, maybe early next year. I'm gonna have a bunch of stresses coming up, having to do with mostly with people leaving, my caregivers, and trying to get new people and stuff like that over the next month or two. I have a number of people leaving, moving on, and then I have to fill their jobs, right?
Mm-hmm.
So yeah, it'll be stressful, but I'll see how I handle it with the pill reduction and everything. But I think the pill reduction is helping my mind, if I can just deal with the pain and not feel like the world's coming to an end because of the pain.
But the possibility is that once you fully get off gabapentin, you're going to be actually with a lot less pain, right? Yeah. So you're going after that goal. So I'll just wait to hear from you, Nirmal. And
okay, that sounds good.
If I get prompts from my supervisor that I need to kind of make more space, I'll let you know. I'll give you give you a heads up. Otherwise, I'll just wait to hear from you. There's a phone number at the bottom of my email. You can always reach me there.
Yeah. Okay. Sounds good. I'll call you in the new year.
Yeah. Whenever, if you do.
Because I think if I make an appointment, it would be around January. I want to say 7th or 8th, around the first week of January.
Okay.
Let's do that. Let's make an appointment for the first week of January.
Okay. So it's the 7th on the Tuesday. So I'll just send you an email in advance, or I'll give you a call in advance.
Okay.
Okay?
Okay.
Okay. Take care. Good luck.
Thank you.
Okay.
Bye-bye.
Bye.
Well, we talked a lot. Well, I was recording the whole thing. Now I'm going to post it. Hello, my friends. An interesting conversation that was. All right, take care. Don't forget to like and subscribe and share, please, and leave a comment, many comments. Questions, comments, anything. All right, my best.